Assalamualaikum viewers and welcome back to my channel Denver's Hub. Today in the playlist of oral and maxillofacial surgery we will be discussing the same prevention and management of extraction complication. In that regard our today's video will be about the Oro Antral Communication and Fistula. So in this video we will be studying its etiological factor, the etiopathogenesis, the clinical features, the diagnosis and confirmation, and the management of oro antral communication or oro antral fistula. So, first of all, let us study what is basically an oro antral communication. So, communication, it is basically the immediate history after the extraction. Communication between the antral and oral cavity but without the epithelial lining. So the patient will be presenting immediately after the extraction and you will be noticing a communication that has been formed between the maxillary sinus and the oral cavity. But most importantly, it will be without the epithelial lining. So in that regard, it will be the oro-antral communication. Now we will be studying that when it will be an oro-antral fistula. So basically, whenever the patient presented with a history of 2 weeks after the extraction, means 14 days after the extraction, if patient presented with this history and enlarged communication between the antral or oral cavity, and here the most important thing to be noted is that this communication, it will be lined by a pathological epithelial membrane lining the tract. So what are the difference between the communication and fistula? Communication, first of all, the patient will be presenting immediately after the extraction, and in the case of fistula, patient will be having a history of 2 weeks after the extraction. Then the communication between the antral and oral cavity will be without the epithelial lining, but in the case of fistula, there will be enlarged communication and it will be lined by a pathological epithelial membrane. So by understanding these features, you can easily differentiate between an oro-antral fistula or communication. So now let us study the etiological factors, that what are basically the causes for this condition. So you can remember it by the mnemonic of X pit. First of all, the first etiological factor is extraction, most common cause of this formation of the oro-antral fistula and communication. In the case of maxillary posterior teeth, that is the second premolar, the first molar and the second molar, or in case of the divergent roots of the maxillary posterior teeth, in that case they should be sectioned with in the anticipation of the difficulty level. After that, if there is any periapical lesion that was present prior to extraction, or any pneumatization of the sinus, in that case if the volume of the sinus has increased, or in case of single standing tooth in the edentulous or partially edentulous arch, in that condition where all the other tooths have been extracted, so it is very obvious that sinus lining will proceed downward and there will be the pneumatization of sinus, and in that case there will be a very less and close proximity of the maxillary sinus and the associated tooth. Or in case of any long rooted canine. And last, if there is any fracture of maxillary tuberosity, in that case also there is high probable chances that oral antral communication or fistula can occur. Now another etiological factors is the pathological entities. For example, if the patient have any cyst, tumor, osteomyelitis, malignancy or syphilis, these all pathological conditions can result in the formation of oral antral communication and fistula. There are also some iatrogenic causes. For example, during the episectomy or during any implant surgery or by the Carvel-Luke surgery, orthognathic surgery, that is the Lefort 1 and 2 maxillary advancement and setback, and also the enucleation or maxillectomy. In case of performing these procedures and surgeries, you can iatrogenically result in the oral antral communication and fistula formation. The last important etiological factor is trauma. That is if there is the maxillary fracture and that resulted in the palatal split. So these were all the etiological factors and causes of the oro-antral communication and fistula. Now we will be studying the etiopathogenesis. So for example, you have studied all of these etiological factors. In that regard, if there is any of it present, any etiological factor is present, it will cause the penetration of antrum, and that will result in the formation of a blood clot. Now, there are two consequences of it. If the blood clot organizes, the healing of the perforation will occur, and it is usually a very small opening, that is 2 to 3 mm. It will usually heal the blood clot due to the blood clot organization. But if there is a very large opening, the blood clot that has been formed, it will be dislodged or it will get infected, and it will result in the persistence of this opening and persistence of this communication. That will usually and eventually lead to the epithelialization of the tract, and that will be leading to the formation of oro antral fistula. So this was the etiopathogenesis of oro antral communication and fistula. So now we will be studying some clinical feature associated with both conditions. So first of all, in case of the early features, we have already discussed that in case the patient is presented with the immediate history after the extraction, so that will be the case of oro antral communication. But if the patient presented with the history of 2 weeks, it will be the features that are late features of the oro antral fistula. So let us study the early features. There will be pain, but it will be less severe. Escape of the fluid through the nose. Escape of the air also. Epistaxis, that is the bleeding of sinus, it will come out through the nose. And the nasal tone of the voice. So these were some early features. Now, if the condition progresses and the epithelialization of the tract occurs, there will be some late features as well. And that will be depicted as the oro antral fistula. So the late features that could be occur if there was prior any acute condition and it progresses after some weeks, it will be presenting the late feature. Also the chronic maxillary sinusitis, if it is present for months, it will be depicting the same late features. So here the pain, it will be severe due to sinusitis. The tenderness in the infraorbital region, which is the most important late feature, that patient will experience a tenderness in the infraorbital region. Purulent nasal discharge, post-nasal drip, popping out of the antral polyp into the oral cavity. You will be seeing out an antral polyp out. It will be popping out through the opening into the oral cavity. Or patient could also have some systemic reactions in case of the acute cases. Patient will be suffering from the fever, headache. Another important feature is the nasal mucosa congestion, because there is the condition of sinusitis and inflammation around the ostium, and due to which there will be the nasal mucosal congestion. The patency of the ostium will not be maintained in that regard. Also, the patient will also experience the halitosis because fluid lodgement into the sinus, leakage of the fluid or air through the nose, and also the epistaxis. So these were some important clinical features. If the patient present with these features, you can easily diagnose and differentiate between the oral antral communication and oro antral fistula. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also hit on the bell icon so you will get notified about our future videos and updates.